Well, we're ending the month of May, but not before we talk about Women's Health Month. That's why we're back at Advanced Orthopedic Specialist. We're here talking to Olivia Fritchie. She is a physician's assistant here. We're going to be talking about osteoporosis.
Yeah, you're like, osteoporosis, what in the world even is that? But you think of osteoporosis, which means soft bone. As we age, you hear about, oh, someone fell and broke their hip. That's like the typical story that you hear, and so that's osteoporosis, more than likely, because as we age, our hormones change, our activity levels change, and so that increases our chances of osteoporosis. And so working in orthopedics, obviously, we see a lot of bones, and so one thing we've noticed over time is, bones soften over time, and a lot of times patients come in with they've broken their arm or they've broken their hip or various things like that. And so what that made us realize is bone softening, osteoporosis, it's something that is very common, but it's something that's not treated. Or they may treat it with like calcium or vitamin D, but there are certain patients who need more than that. And so that's why we actually started an osteoporosis clinic here, because we're a big proponent of preventative health.
Olivia, who should visit the osteoporosis clinic?
Several different people should visit it. One, it is the month of May, which is Women's Health Month, and it's interesting, we're doing this during May because females are the most likely to get osteoporosis. And that's for a couple reasons. Whenever we go through menopause, our hormones level change dramatically. And so because of that, it increases our chances of osteoporosis. Also, females that have had a hysterectomy, because your hormones level do similar if you've had a complete hysterectomy. Also, any adults who've had several fractures. Now if you're a big mountain biker or something like that where you high levels of activity and you break things, that's a different story. But if you fall and you're always breaking things, a red flag always goes off if you've broken several bones as an adult. And then also patients who are on like long-term steroids, so if they have autoimmune issues, if they have GI problems, various things, rheumatoid arthritis, various things, if people take steroids for long periods of time, you're at an increased risk for bone softening as well. Also, other patients that are smokers, if you tend to drink a lot of alcohol, those are risk factors that increase your chances of osteoporosis.
Olivia, if we decide we want to come in, what does a full workup look like?
So say you see this on TV or you hear about someone that talks about osteoporosis and you're like, I want to be seen. You just call our clinic. We're really good about getting patients in right away, and you would be seeing me. And what we would do is basically we would first start with just a survey. We would start about asking about your history, your personal history, if you had any fractures, your social history, so do you smoke, go into all those kinds of questions, your medical history, and then after that we'd kind of dig in more to you specifically. And so the great thing about what we do is, we get a lot of lab work. So the lab work helps, we want to see your calcium level, we want to see your vitamin D level, we want to see your thyroid and other endocrine related labs, because what we've realized is how your electrolytes, your blood work, how that really affects your bone health. So that's where we start first, and then we also get a bone density test. So any person who's over the age of 65 should have a bone density test. But especially if you're in that higher risk category, the age could actually be even lower than 65, if you've had fractures, kind of what we previously talked about. And so after you have both of those things done, then you come back and see me, and we go over all the lab work, that anything that's abnormal and that sort of thing, and then we go over your bone density results. And then we make a plan together that's the best treatment plan for you individually.
What's something we can do from a preventative measure, maybe to make sure that we have strong bones?
So, it depends on your age, of course. If you're young, multivitamin number one thing, and just trying to be active. And as we age, weight-bearing exercises is like one of the best things. So walking, those sort of things, being active is very, very important. And then vitamin D, actually. So it's crazy how so many people are deficient in that, and how it's such an easy thing to then help keep our bones strong.
Olivia, remind us, if someone wants to make an appointment with you to do a full workup, how can they do that?
So we work at Advanced Orthopedic Specialists. We have an office in Fayetteville and in Rogers, which I go to both offices. We'd love to see you and help get you treated and prevent osteoporosis, or at least treat it to allow you to live the best life.
We learned so much about osteoporosis and how to keep your bones strong. Speaking of strong bones, we'll be right back with more Good Day in WA.
Olivia, my elbow.
Are you all right?